Hello people, in this video we want to look at indicators of health indicators. So this is important for exam and there are so many terminologies here, so pay attention. So how healthy is a given community? How do you know? So you need some indicators to compare the health status of one country with the health status of yet another country. So why do you need health indicators? To measure the health status of a community, to compare the status with something else, assess the healthcare needs, the services, whether they are being utilized, etc. Also, you can know whether the targets are being achieved of these programs, health programs that you create. So basically, indicators of health are variables that help to measure change. So what is the difference between an indicator and index? They're saying indicator is good, okay? Indicator is preferred to an index. So indicator is preferred. A group of indicators will become an index. So indicator, okay? A group of this, an amalgamation of these will become an index. Which do they actually prefer, guys? They prefer indicators. Indicators are preferred over index. So did you understand the difference between index and indicator? In this video, what are we looking at? Health indicators. What should be the characteristic of an indicator? Ideal indicator. It should be valid, it should measure what is supposed to be measured, it should be reliable, it should be objective, it should be sensitive, it should be specific, it should be feasible, it should be relevant. So all these things you'll have to write about an indicator. What will you write? It should be valid, and then it should be feasible, it should be specific, it should be sensitive. What and all? What are the other terminologies they said here? Valid, reliable, it should be objective, it should be, that means it should not be subjective, it should be objective, it should be sensitive, it should be specific, it should be feasible, and it should be relevant. So these are the characteristics of indicators. Then, there is not one health indicator which can do all these things. Okay, so that's why they have so many health indicators, looks like. And it is not just these indicators. Health itself is so multi-dimensional that each dimension is influenced by so many factors. So you need so many health indicators. Now let's get started with health indicators. Now we have reached the actual indicators that you will write for your exam. Okay. We will just give you the names and what comes under them. You will have to elaborate each one. So you have mortality indicators, morbidity indicators, disability rates, nutritional status indicators, healthcare delivery indicators, utilization rates. So the healthcare, whatever programs you made, utilization rates of those, indications of social and mental health. So not just physical, right? It is not just physical. It is about social and mental health also. You have some indicators for this. Environmental indicators. So all that, let us see what will indicate that you are living in a good environment. Socio-economic indicators. So all this you will have the per capita income, etc. Right? Health policy indicators. People, how good is this policy? Indicators of quality of life and other indicators. Did it just go above your head, guys? There are so many indicators and each of these will have some things under them. So you'll have to look at all of it. Okay? Let's get started with mortality indicator. Under mortality indicator, what and all you have? You have crude death rate. Okay. So guys, mortality rate, you have so many things. Please pay attention here. You have crude death rate, infant mortality rate, child death rate, under 5 proportionate mortality rate, adult mortality rate, maternal mortality rate, right? Disease specific mortality rate, proportional mortality rate, case fatality rate, years of potential life lost, YPLL, and then expectation of life. So basically all these are mortality rates. And what is mortality rate? It is a health indicator. Okay, now let's move to morbidity indicator. So this is more like ill health, disease. So let us say the mortality rate is less, but does that mean that people are living healthy? No. So you need a morbidity indicator also. So here what and all you will see: incidence of the disease, prevalence of the diseases, notification rates, right? Notifiable diseases, you will be able, the government should be getting information about these diseases. Attendance rates as outpatients, you can see how much of outpatient, how much of inpatient admission is happening, readmission, discharge rates, what are they? So this will indicate morbidity. So you will know people are just living or they are living healthy. Duration of stay in the hospital, spell of sickness, absence from work. Absence from work also can indicate morbidity. Okay. So this is about morbidity. So we are done with mortality and morbidity. Now let us move to disability rates. Now let us look at disability rates, guys. So you have event type indicators and person type indicators here. So basically what are they showing here? Person may not actually be having pain or something, but his full range of daily activities may not be there. Okay, so that will come here under disability rates. So you have event type disability, event type indicators like number of days of restricted activity, how many days this person was bed disability days, work loss days, events, so how many holidays he took, like that kind of a thing. Person type, so let's not say holiday, it's more like how many leaves he took, absence from work. Person type indicators, you can have limitation of mobility, limitation of activity, all those will be person type indicators. Limitation of mobility means he's confined to bed, right? What limitation of activity means? Limitation to performing the basic activity like eating, washing, dressing. So all those will be person type indicators. So what and all you have here? Limitation of mobility, limitation of activity. Guys, pay attention here. How is it going? What are we looking at? We are looking at disability rates, right? Under that we have event type indicators, which will be like more like leaves, how many he took, like kind of thing, and person type indicators. That one is showing limitation of mobility, limitation of activity, etc. Then you have HALE, health adjusted life expectancy. So it is basically life expectancy, you already know, right? So you're adjusting it based on how much of it is healthy in that life expectancy, how much of it will be healthy. Then you have QALY. What is QALY? Quality adjusted life years. DFLE, disability free life expectancy. This is also same as Sullivan's index, right? So this is life expectancy without disability. So you'll take life expectancy and subtract the disability part of it. DALY is disability adjusted life years. As you can see, Y is years, right? So it is expressed in the number of years lost due to ill health, etc. What is here? QALY is quality adjusted life years, remember, okay? These two are life expectancy, HALE and DFLE. These two are life years, LY. So they have a lot of disability rate indicators. Guys, did you understand? Disability rate is an indicator of health. We are not going into the details of anything. We're just looking at these terminologies. That itself is so much. Let's look at nutritional status indicators. So how will you measure nutrition of a person? Anthropometric measurements. You can check the weight, the height, the mid-arm circumference, right? Then what else? Low birth weight, mainly weight, height and all they're talking about. Then you have healthcare delivery indicators. Guys, we are moving on. Here what will you see in healthcare delivery indicators? You will see the doctor population ratio, doctor nurse ratio, population bed ratio, population per health subcenter. For every trained birth attendant, how much of population? So basically it is an indicator as to how many doctors are there, how many nurses are there, how many subcenters are there per population, how many beds are there, how many birth attendants are there. So all this will become healthcare delivery indicators. Okay, that is also an indicator of health. So if you have more, that means people are getting availability, things are available, people will keep themselves healthy. Utilization rate. So now that you have given all these facilities, are people utilizing it? Then how will you know that? So how will you assess utilization? How many people got immunized, right? How many pregnant women received antenatal care? How much of the population is using family planning? How many of these beds are actually occupied, right? Then what is the length of stay in the hospital? Then what is the bed turnover ratio, discharges, average beds? All that will be utilization rates. Then moving on to indicators of social and mental health. So now they are not just considering this physical thing of it, they are also considering social and mental health. So how many acts of violence, criminal activities, road traffic accidents, juvenile delinquency, alcohol, drug abuse, smoking, how many people are taking tranquilizers, obesity, what is there, all that will indicate social and mental health. And they are also considering family violence, battered baby, battered wife syndromes, neglected, abandoned youth, etc. How's it going, people? What are we looking at? Health indicators. Can you say health?
Health indicators.
Indicators, yeah. So we have looked currently at, till here we have looked at, now we have to go to environmental indicators. Can you say environmental?
Environmental indicators.
Environmental indicators, okay. So here what and all will they see? Air pollution, water pollution, solid waste, radiation, noise, exposure to toxic substances and food, water, safe water, adequate sanitary facilities, all that will be indicator of environment. Socio-economic indicators, what and all will be there here? Rate of population increase, per capita, gross, what is this, GNP? What is GNP? Gross national product, levels of level of unemployment, right, dependency ratio, literacy rates, family size, housing. Okay guys, pay attention. Per capita calorie availability also they are considering. Per capita calorie availability. Literacy, don't forget all these, okay. All this will become socio-economic indicators. So literacy also is coming here. So it's money, literacy, everything. Rate of population increase, etc. Calorie, per capita calorie availability also. Okay, we'll move on to health policy indicators now. So we are moving to health policy indicators. So we have an allocation of adequate resources, proportion of GNP, gross national product spent on health services. So how much is the government spending on health services? How much of health related activities like water supply, sanitation, housing, nutrition, community development, proportion of total health resources devoted to primary health care. So all that you will write here guys, primary health care, right, all that you write here, amount of proportion of GNP which is spent on SPENT, spent on health services, etc. Okay, those will become health policy indicators. Now let's move on to next one, indicators of quality of life here. Let's just move this up here. Indicators of quality of life. Indicators of quality of life. So what should you see here? Basically these are index, okay, human development index, physical quality of life index. These are kind of bringing together all these parameters and making an index. So that is a quality of life kind of thing, okay, QLI, remember, quality of life. So physical quality of life index is one such index. So it will consolidate these indicators, like what indicators, like infant mortality, life expectancy at the age of 1, literacy, all that it will combine and it will try to give you a quality of life, okay. Then other indicators guys. Here they are talking about some social indicators again guys. Population, family formation, families, household, learning, education services, earning activities, distribution of income, consumption, accumulation, social security, welfare services, leisure, culture, social stratification, so many things, housing, environment, so many things are there, okay. Then basic need indicators, there is something called as a basic need indicators. Let's look at this also. Basic needs indicators. And here what are they talking about? Calorie consumption, access to water, life expectancy, deaths due to disease, illiteracy, doctors and nurses population per population, rooms per person, gross national product per capita. So we have looked at all the health indicators guys. Can you name the health indicators? Can you say mortality? Mortality, yeah. Morbidity rate, disability. Then what else did we see? Health services, something, right? Healthcare, delivery indicators, nutrition, utilization of these healthcare things, indicators of social and mental health, environmental indicators, socio-economic indicators. Can you say socio-economic? Indicators. Yeah, health policy indicators, quality of life, other indicators are there. So all this will you be able to remember guys for the exam. The thing is, this video is not just about these health indicators. There's much more. There are special indicators, okay. So we need to look at these special indicators like health for all indicators. So what are health for all indicators? There are some Millennium Development Goal indicators, Sustainable Development Goals, Global Reference List for core health indicators. And what are these core health indicators? There are some 100 core health indicators, 100. So much is there. Let us try to look at these. Health for all indicators. Look at these health for all indicators, guys. Health policy indicators, social and economic indicators, indicators for provision for healthcare, health status indicators. This is all coming under health for all. Health for all. Under health for all. What are we looking at? Health?
Health for all.
Yeah, health for all. So you have health policy indicators, political commitment to health for all, resource allocation, equity of distribution, community involvement, organizational framework, managerial process, that is coming health policy indicators. Then you have social and economic, same thing, GNP, GDP, rate of population increase, income distribution, work condition, literacy, housing, food availability, again here social and economic, okay. Then indicators for provision of healthcare, availability, accessibility, utilization, quality of care, same thing, this is healthcare. Then you have health status indicators, this is the actual health status indicator, low birth weight, nutritional status, infant mortality rate, child mortality rate, life expectancy at birth, maternal mortality rate, disease specific mortality, morbidity, disability. So all those are, they have grouped them together in health for all indicators. Then guys, Millennium Development Goals adopted by United Nations. Let us look at this. Some goals they have. Eradicate extreme poverty and hunger. So they want to eradicate extreme poverty and hunger. That is the first goal. Second goal is reduce child mortality. Third, okay, this is, where is second? Second is not there, directly 4 this is. And this is 5, improve maternal health. So child and maternal. 6 is combat HIV, AIDS, malaria and other diseases. Then you have 7. Goal 7 is ensure environmental sustainability. Then goal 8 is develop a global partnership for development. Who can remember all these? Okay, so just remember that some child, maternal, HIV, AIDS, environment, 7 is environment and 8 is some global partnership. What is the first goal, Millennium Development Goal? To eliminate, to eradicate extreme poverty and hunger. Can you say eliminate?
Eliminate.
No, sorry. Eradicate. Eradicate extreme poverty. Yeah, poverty and hunger. Okay. Do you know what hunger is? Hunger means, you know, how feeling hungry. Yeah, that is hunger. Okay. Then you have sustainable development goal, guys. So again, these goals are really sustainability development goals, is it? So by 2030, reduce global maternal mortality to less than 70 per 1 lakh live births. Then preventable deaths, end preventable deaths. Okay, neonatal mortality should reduce to as low as 12 per 1,000 live births. Okay, then end the epidemic of AIDS, reduce 1/3 premature mortality. So many things they want to do, guys. There are more on this. Please look at that. Okay, sustainable development goals. You have to look at the textbook from that. It is also a special indicator of health. Remember that. Global reference list for core health indicators. So there's a reference list of 100 core indicators. Let's look at this. This is the reference list. Global reference list is a standard set of 100 core indicators. What are these indicators? Let us look at that. Same thing only, guys. They're writing 100 times. Health status, life expectancy at birth, adult mortality rate, under 5 mortality rate. Same thing only they are writing, but 100 they have just, what is this? Under 5 mortality rate, infant mortality rate. Then what else you have? Neonatal mortality rate, stillbirth mortality rate, mortality, maternal mortality, TB mortality, AIDS, malaria, mortality between 30 and 70 years, cardiovascular diseases, cancer, diabetes, suicide rates. Suicide they have included here. That's the only thing new. What do you say? Then you have fertility rates. Here again, fertility is new. So far we didn't see fertility rate, isn't it? Adolescent fertility rate, total fertility rate. So they want to see how many adolescents are also giving birth. Morbidity. When it comes to morbidity, all about diseases you will write, right? New cases of vaccine preventable diseases. IHR notifiable diseases, how many are coming, HIV incidence rate, HIV prevalence rate, hepatitis, STIs, TB. I know you're getting tired, guys. So many are there. Malaria, cancer, all that is coming under health status. Guys, just look at this. Basically, this health status is coming under impact. So all this will impact this final thing, all these mortality, morbidity, fertility, etc. So health financing, health workforce, health infrastructure, health information, service access and availability, service quality, safety, coverage of interventions, risk factors, behaviors, all this is the outcome. What is there under outcome? Under outcome they have put coverage of interventions, demand for family planning, risk factors, behaviors, all that is coming, and finally it is affecting what the health status and the financial risk protection looks like. That is coming under impact. Did you understand, guys? There are some 100 core health indicators. Okay, in that you have health financing inputs. These are inputs. Health workforce, health infrastructure, health information. Then that will lead to output, input, output, outcome, impact. Okay. So please pay attention to this. If you want, you can look more at this. But basically, all these are coming under health indicators. Okay, some 100 core. 100 core. Can you say core?
Core.
100 core health indicators. Okay, Yes, let's take a recap. In this video, we wanted to look at health indicators. It just went so above the head, right? So many health indicators are there. So let us look at these health indicators. What is indicator? What is it? It's a measure of the health status. You can compare the status from one another country, etc. Assessment, you can assess what is the need of the people, healthcare needs, what are the services. You can evaluate, you can find out whether the program's targets were attained. Okay, so basically it is a variable to measure change. Okay, and what is the difference between indicator and index? Group of indicators will become an index. Indicator is preferred to index. Okay, that's what they're saying here. Characteristic of indicators: this should be valid, reliable, objective, sensitive, specific, feasible, relevant. Okay.
What is he writing?
He's just finding out the value. He's drawing the graph or something. Okay. So basically, indicator is preferred to index. Okay. So we learned what indicator and index difference are. We saw the characteristics of indicators, right? Ideal indicators. Then what else, guys? Let's move on. Health itself is multidimensional, so you will have so many indicators. Health indicators, mainly you should write mortality, morbidity, disability rates, nutritional status indicators, healthcare delivery indicators, utilization rates. Okay, social and mental health indicators, environmental indicators, socio-economic indicators, health policy indicators, indicators of quality of life, and other indicators. So what did you see under mortality indicators? You saw infant mortality rate, maternal mortality rate, under 5 mortality rate. What else did you see? Crude death rate, right? All this we saw. Years of potential life lost, all that mortality rates. We saw morbidity indicators, indicate in this incidence, prevalence, then rate of outpatient, admission, inpatient, readmission, discharge, stay in the hospital, right? Bed occupancy, all that you can say. Disability rates will be like event type or person type. You have HALE, QALY, DFLE, DALY, all these we have seen. Special indicators, we saw health for all indicators, where you saw policy indicators, socio-economic indicators, indicators for provision of health care, right? Then finally, health status indicators. Similarly, Millennium Development Goals, we saw goal 1, they want to eradicate extreme poverty, hunger. They want to reduce child mortality, maternal health, they want to improve, they want to combat HIV, AIDS, malaria. Then they want to have some environmental sustainability and develop partnership, global partnership. Sustainability development goals, they saw by 2030 what and all they want to do. By 2030, they want to end preventable diseases. They want to end the epidemics of AIDS. They want to reduce premature mortality. They want to reduce global maternal mortality. They have some targets also set. Okay. Then you have global preference list of 100 core indicators. This is important. These are 100 core indicators, guys. So other than those indicators you saw here, there's 100 core indicators, and the way they have arranged this is input, output, outcome, impact. Okay. Under input, we saw what and all: health financing, health workforce, health infrastructure, health information. These are the inputs. Outputs will be services. Then what is the quality of these services, safety levels of these services. Then outcome, what is the coverage of interventions. Then risk factors in behavior. Finally, impact it will have on this health status, all these mortality, morbidity, fertility, etc. And financial risk protection. So that is under impact. So these are the 100 core health indicators. So in this video, we have looked at a lot of terminologies which are called as health indicators. Okay, guys. We'll meet you in the next video. Bye-bye.
Bye-bye.